Jordan Griffeth is my son. He's the one that found the problem with my esophagus.
Jordan Griffeth. I'm a nurse practitioner. I live in Sandy, Utah.
My aunts and uncles, almost all of them on both sides, died of cancer. So I figure that one day I'm going to get cancer and I'll probably die of cancer.
How we addressed Barrett's esophagus before TissueCypher, it was very difficult because you're sitting there saying, yeah, we think this is what's going to happen, or we think that in the next several years that you could possibly progress to something bad like cancer. Without TissueCypher, it's been a gray area. It's been hard to tell someone yay or nay. These puzzle pieces, they're a lot harder to put together without TissueCypher. With my dad, it's pretty unique on the relationship that I have with him, especially since, he's had some issues with GI. He had an EGD actually earlier in life, and they hadn't seen any progression of Barrett's or any esophagitis or inflammation or anything of that matter. But as time has gone on, his issues and some of the reflux has been worse, even though he really didn't have much reflux before. We decided that, we're going to do a colonoscopy anyway because he's had polyps before in the past. Hey, let's get you in for an upper endoscopy. Let's make sure that everything is looking good and that we can have peace of mind in your health. So we decided to send him for an upper endoscopy, and our physician took biopsies and found that he had Barrett's. Well, that biopsy also got sent to TissueCypher, and TissueCypher was able to give us the ability to understand how serious his condition is. And boy, it hit us hard.
It was nice to know that from my son Jordan that it wasn't cancer yet, and that something could be done to correct the disease or eradicate the disease, so that I didn't have to worry about having cancer again.
Without TissueCypher, we probably would have sent him again for another biopsy in 5 years. And to be honest, it would have been too late. That's what TissueCypher has done for our family, to be able to give him another chance at not having to go through chemotherapy again, not having to go through radiation or surgeries again, but to be able to, nip it in the bud and make him as healthy as possible without so many more interventions in his life. When you have these symptoms, go get help, go check, make sure, because if we can catch it before it gets progressed, it's going to be so much easier on you and on us. Nothing can bring you more joy to know that your loved one, specifically my father, is going to be around a little bit longer and have more loving memories of him, have him around my family, have him be a grandpa, continue to be a grandpa, and not have to worry about Barrett's esophagus, not have to worry about the plague of cancer being on our family again.